This is medicine 3.0. Hi, my name is Robert Santrock. I'm an orthopedic foot and ankle surgeon located on Amelia Island, Florida, which is just north and east of Jacksonville. Having something like TendoNova, which is essentially a mechanical treatment, allows me to do what I would do in surgery in a much less invasive way, an immediate way, and have it available in the office at a convenience to the patient. And this has changed my entire outlook. Instead of looking at these types of procedures as in-stage treatments, I look at them as first-stage treatments so that you can maybe avoid the surgeries in most of our patients. The word might be more of mechanical stimulation by using this small needle to help do minor directed purposeful injury to the tendon or soft tissue you're trying to treat, which allows for a natural stimulation of blood flow or angiogenesis, allows for a natural flow of healing tissue in a directed way, a measured way or metered way. And this allows you to get the maximum return for the minimum incision, minimum invasiveness. That's the way I look at it. So when the unique thing about TendoNova, what's really changed my practice in the last year, has been that this has become my direct first treatment for anybody that has this. Yeah, so in my opinion, the patients have a directed improvement with TendoNova because we're actually treating the tissue. So the benefit to the patient is to actually treat the tissue to speed the recovery. It's not only speed, but it's the quality of recovery, right? And so think of it this way, there's definitely benefits from things like physical therapy, but what do we use in physical therapy for? We're trying to gain mobility, trying to gain strength, and we're trying to gain essentially blood flow to the tissue that's damaged, but we're doing it in an indirect way. This is a direct way. We're going to go into the injury site, we're going to stimulate it directly, which to me scientifically makes the most sense and gives me the most directed treatment or the most speedy way to get their tissue to respond. So adding this before therapy or adding it during therapy is more beneficial in my opinion. So for me, I try to explain to my patients that this is medicine 3.0. We're going to basically not just observe you have something and recommend that it doesn't hurt and try to give you something to make it doesn't hurt and try to get better indirectly, but we're going to actually directly treat it with the science of stimulating healing by direct blood flow and direct right amount of growth factors and other things to get in there by actually mechanically treating the disease. It's just like surgery, but done micro-invasively. Yeah, in just a short period of time, we've been able to do probably close to a dozen of these for a variety of different soft tissue injuries. We've done everything from hip and lower extremity things. The vast majority of ours have been in the foot and ankle. It's most people get referred to me for. So for us, we've seen the vast majority of our patients respond positively to the point where they're actually doing quite well at that very short interval. I mean, in the sense of we usually receive people within 6 weeks. And so that very short interval is extremely good for the patients. They're very happy. So first off, their lifestyle does not change, right? So they're back to their normal lifestyle, normal work, normal activities, normal physical desires, whether it's riding bicycles, playing pickleball. We don't stop that. Interesting stories. I had a gentleman come in a month before he was going to go on a multi-state trip to Major League Baseball stadiums. Lifelong dream. He was going to go visit Major League Baseball stadiums all over the country. He has this trip planned. He starts having peroneal tendonitis. Peroneal tendon's very important. He's hobbling, walking. He's like, "Doc, you got to give me some solution to not miss this trip. I do not have time to recover from surgery." So we did the TendoNova procedure on him. He's been able to go and visit 8 Major League Baseball parks. He's sending us pictures from the road. He's extremely happy. And his words are, "You fixed my problem. You let me go on my lifelong trip." Another gentleman who had Achilles tendonitis, mid-substance, similar to the video we just shot, but more in the mid-substance. He goes to Europe. He owns farms over there in Europe, I think lavender farms, and he goes over there every summer. And he was getting ready to leave, and we did the Achilles tendon treatment for him. Comes back in for his checkup 2 weeks before he's going on his trip. He's 4 weeks out from his procedure, and he says, "Achilles tendon's cured. I'm fine. I'm ready to go. I'm not going to have any trouble going hiking around my lavender farms." And we stimulated a more direct healing after months of not getting better with other other non-invasive treatments. I've assessed other competing solutions for soft tissue overuse syndromes, and one of the things that TendoNova brought around to me is it was one, familiar with how I do things already in the surgery. It's mechanical. I'm going to make mechanical, and let's use the word debridement. Well, I like to call it directed stimulation. It's just making minor pathways or holes in the tissue to allow for new healing tissue to go in and stimulate with healing factors to get in there. But other types of devices that may use electrocautery or may use water flow, high pressure water flow, they're interesting and they're neat. I've tried them. However, what I found with them is that I had a less of a tactile feedback, no tactile feedback. So to do it completely minimally invasively was less intuitive for me. And two, it was that I had a less of a certainty of the zone of directed injury I was creating. Does that water extravagate? Does the electrical current extravagate and get broader than what I'm trying to treat? Where the mechanical, I know what I'm treating. I know where the needle pass goes is what I'm treating. I know how many needle passes I can make and know what zones I'm actually treating. So for me, it was more intuitive of like what I do in surgery when I actually cut away damaged tissue. So that's the biggest change for me. This, as soon as I saw it, said this makes sense. I was already doing needle tenotomy, when I would do a plantar fascia injection, for example. But this is just a much more effective and much more directed needle tenotomy because I have the mechanical device oscillating at a significant RPM. I can actually pass it very gently in directed places where I want it, as opposed to a broad sweep, of which to me was a little ambiguous, and I preferred this over the others. The amount of time it takes to do a TendoNova in the office is very, very minimal. I often combine this with PRP treatments too, so when we combine it with that, we still don't have this huge amount of time sink in the office. A lot of people might be concerned about that. Put a patient in a room, greet them, make sure we're doing the right thing. We cleanse the skin and numb it up. I give them about 10 minutes. I go off, see another patient. I come back in 10 minutes. I'm ready to do the procedure. The procedure takes me about 1 to 2 minutes to do of the actual TendoNova work. It's very quick and easy. If you need ultrasound guides, maybe that's a little bit more complicated in some places like the shoulder or the hip deep in, but that might take you 5 minutes. The procedure itself is very quick. It's a needle tenotomy essentially, so it's not a very long, difficult treatment. After that, if you're going to supplement with PRP, that maybe take another 1 or 2 minutes. So in actuality of my surgeon time, about a minute to numb somebody up, about a minute to do the treatment. If you want to add something like PRP or other instructions, then that's another minute. It's about 3 minutes of my time. My staff, without PRP, this is 5 minutes of their time, so my room cycles over. If you had multiple rooms, these can go back to back to back. I give patients about 10 minutes to numb up. I do it local. That's all I do. I haven't had to do a regional yet. I would be prepared to do ankle regional just fine, but I haven't had to do that yet. Usually it's just locals enough, and I go off, see another patient, come right back and do the treatment. So for me, this fits in my normal flow of patients during the day. I don't have to disrupt my normal patient flow or cause any delay in my scheduling. Yeah, and the other factor with these other devices is that you have some sort of setup that required a special machinery. This is not special machinery. I mean, I have just this battery power here. I'm going to open my sterile kit. This docks into here, and all I have is the needle to deal with. I have no cords. I don't have any other special devices. I don't have water or other things they have to deal with. To me, all I have to make sure is that this is charged overnight and we've had it ready to go for the next day, which we just leave it charging all the time. And so that was a much simpler setup, less intimidating to the staff, and easier to not disrupt your room. You can do this in any room in my office. And it's significantly a lot less than the competitors had shown me on their pricing. We can get reimbursed for TendoNova, I found, both in our office as well as in the surgery center. This comes along with CPT codes for tenotomy. So we've had no problem billing this to all of our major insurance carriers and Medicare. So it's an insurance billed process, just like any other surgical technique. So we just have to have an operative report to make sure that coincides with the notations for the reimbursement. We've billed it directly to all of our insurers and haven't had a problem getting reimbursed at all with that. From us, the cost is the cost of the kit, The reimbursements seem to be favorable enough that this is absorbed, so it is a profitable thing for me in the office to do.